The novel coronavirus has affected more than 450 million people, leading to more than 6 million deaths worldwide. Now, the virus, we all know, has caused significant morbidity, mortality, and economic consequences throughout the world. With over 24 months into the pandemic, there is evolving evidence regarding complications and late outcomes. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan and I'm going to discuss the incidence and the outcomes of cardiac complications of COVID-19 patients. We all have gathered till date that the virus has left its effects on our bodies. The SARS-CoV-2 virus typically causes respiratory symptoms that can progress to respiratory failure, even requiring ventilation and leading to pulmonary complications. Other organ systems such as the cardiovascular system are also equally affected. Studies have shown greater prevalence of hypertension, diabetes and ischemic heart disease in hospitalized COVID-19 patients who are actually ill, and the mortality is much higher in patients with pre-existing cardiovascular conditions. Several studies have emerged that described heart failure, myocarditis, acute myocardial injury, and atrial fibrillation that have been associated with COVID-19, but their prevalence in a real-world COVID-19 population is unknown. As per a recent study that was published in the Indian Heart Journal, patients with COVID-19 who have cardiac complications have a higher risk of mortality when compared to those without any cardiac complications. Now, COVID-19, as the coronavirus disease 2019 as we all call it, has been associated with pre-existing cardiac complications as well as cardiovascular complications. It is a well-known fact that the etiology of cardiac complications in COVID-19 is probably multifactorial. The incidence rates of cardiac complications, age and gender differences in this population is still quite unknown. The researchers have compared patients with and without cardiac complications in patients with COVID-19 and obtained the survival data. The study assessed a total of close to 82,000 patients with COVID-19 and it was found that cardiac complications occurred in 9.3% of patients. That is, acute coronary syndromes in 1.3%, heart failure in 4.4%, atrial fibrillation in 4.5%, sinus bradycardia in 1.9%, ventricular tachycardia in 0.5% and complete heart block in 0.01%. The mortality ratio was significantly higher in patients with the cardiac complications, accounting for close to 20% more than those without cardiac complications, which was around 2.9%. It was also found that the older males seem to have a higher incidence of cardiac complications and mortality. Hence, cardiac complications were observed in approximately 10% of COVID-19 patients, and when cardiac complications do occur, patients have a higher mortality as compared with patients without any cardiac complications. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.